Hello everyone, a warm greetings of the day to all the audience. Myself Simran Rai, and today we will be discussing about a very simple topic which is known as pneumothorax. Pneumothorax, though it is a very simple topic, but most of the people in the world are not aware of it. They don't know about it. So today we are going to talk about this topic. So I would be starting with a simple meaning and its definition. Pneumo, which means air, and thorax, which means chest cavity. So together, pneumothorax means it is the space or area between your lungs and the chest wall. So, it generally occurs when the air enters the pleural space. Pleural space, as I've told, is the space area between your chest wall and the lungs. Well, and it causes the lung to collapse by applying pressure on the outer surfaces. And also, air can enter this space through ruptures of small air sac. Through ruptures of small air sac which is called valves. Valves are the small fragile air sacs which is usually present in your lungs which has a respiratory system. And also injury from trauma or medical procedure or increased pressure from barotrauma like mechanical ventilation is also the reason. They are all a type of a lung disease. Now, before going to its type and its diagnosis, I will be sharing you a book that tells about pneumothorax. So, we know about pulmonary disorder. Pulmonary disorder is something that comes under pneumothorax. Pneumothorax, which comes under pulmonary disorder. So it is essential for us to know about the pulmonary disorder also because it will help us to know more about it. It helps us to gain knowledge about it. So here in the screen, I'm sharing you a book. This book, the topic is Bowie and Davis Divine Medicine. So this book basically talks about pulmonary disorder in which there can be or there is a lot of other thing like pneumothorax and also asthma, COPD, hypertension, pneumothorax, etc. We know that COPD or any other disease are also related to the lungs and in a respiratory or for the respiratory. So asthma is something when your air is respiratory system or breathing or there is a problem in breathing, like that we have COPD, and like that we have hypertension pneumothorax, that is high blood pressure in your arteries or in your lungs. So this is the fourth edition book of Bowie and Davis, written by two authors, that is Alfred A. Bowie and Jefferson C. Davis. So this is the book that I'm showing to you, which shares a lot of things about pneumothorax and all. Like that only, I will be sharing a chapter on the basis of this book, and it will be really helpful us to know what is exactly about it is. So here I am sharing you a chapter, that is the book chapter is 24. As you can see, there is written pulmonary disorder, and we have other subtopic also like asthma and all, in which you will be able to learn more about it. So here I have highlighted a point. It is saying that the problem of advising patient with pulmonary disorder on the risks of driving is difficult. Clearly, the most important issue concerning pulmonary fitness to drive is the questions of whether the candidate has ventilatory capacity required for the exercising load associated with the driving. So these are the information, and many of the information here it is sharing about the pulmonary disorder. So I hope that you are learning about it and you are learning more about these things. The highlight point, what does it really says is that it is about advising the patient who is suffering from pulmonary disorder about the diving complex. So this is the thing, or this is the book chapter that I've shown to you. Now, let us know about what is pulmonary disorder and why it is so considered too much, or what it is there that pneumothorax is also linked in it. So, will be giving you a simple definition about what is actually pulmonary disorder. Pulmonary disorder is also known as lungs disorder, and it is somewhat related to your lungs, and it is a condition, any kind of a condition that affects the lungs, that affects your lungs, and respiratory system also, impairing their ability to function properly. So this is the pulmonary disorder, and each in which the pneumothorax is also there. Now let's go to the types of pneumothorax that we have. There are basically major three types of pneumothorax, that is spontaneous pneumothorax, and we have traumatic pneumothorax, as well as we have tension pneumothorax. Now let us look at what is spontaneous pneumothorax is all about. So, what is spontaneous pneumothorax? Spontaneous pneumothorax is something that happens spontaneously. So, for this, I will also be sharing an article which will be helpful for us to know about what is spontaneous pneumothorax. So, as you can see in the screen, spontaneous pneumothorax are divided into two categories, that is PSP and SSP. Primary spontaneous pneumothorax and secondary spontaneous pneumothorax. Primary spontaneous pneumothorax occurs automatically without or knowing eliciting event, which means it occurs knowing without any cause or any disease, whereas secondary pneumothorax, it occurs after the underlying pulmonary disease. So, pulmonary disease can include COPD, lung disease, or interstitial lung disease, anything, or after lung cancer, sorry, or lung cancer, which is very much helpful us for to know. And this SSP is who have already this SSP occurs who have already had underlying diseases. So this is all about the spontaneous pneumothorax we have. And spontaneous pneumothorax, there can be a lot of symptoms. There are types and all. So there are the spontaneous pneumothorax. So the other two types of pneumothorax is traumatic pneumothorax and tension pneumothorax. So traumatic pneumothorax, for this also, for this two types, I will also be sharing article again so that it will be easy for us to know more about it. So what this basically means, first we will look at the traumatic pneumothorax here. Traumatic pneumothorax can result from a blunt or penetrating trauma, so it is usually related to trauma. These often creates a one-way valve in pleural space, letting the airflow in but not flow out, and hence hemodynamic compromise. So this is the thing about traumatic pneumothorax, and it is basically divided into other subtopics. And there are some of the topics, for example, they are divided into. First one is blunt force trauma. So blunt force trauma is some kinds of a trauma that occurs because of sudden forceful impact to the chest. For example, such as during the car accident or in a fall. Second, we have penetrating trauma. Penetrating trauma involves a wound that pierces the chest wall like a gunshot. And third, we have, but not the least, is that latrogenic trauma. Latrogenic trauma is something that or lethargic pneumothorax is something that caused by complications from the medical procedure. So there are some of the kinds or some of the things or pneumothorax that can be caused or it has been caused by the medical operation or medical procedure also. So as you can see in the last but not the least is tensor pneumothorax. Tensor pneumothorax most commonly occurs in ICU setting in positive pressure ventilation patients. I have already said you that there are some of the cases of pneumothorax which can also occur in the hospital sector. As for the traumatic patients' symptoms, there will be sharp chest pain. So we should not neglect these kind of symptoms like this sharp chest pain. We have coughing also, fever type, and problem in your respiratory systems and all. So So, what is tension pneumothorax means? What are its symptoms? Tension pneumothorax is a life-threatening medical emergency where air becomes trapped in the chest cavity, creating one-way valve, the presence of from air from the capacity. So, this is what is telling about. Sorry, I'm little bit not more accurate about the definition, but I hope that I'm trying to give it. So, its causes can be traumatic causes can be like accidents from medical procedure and all. So, this is the tension pneumothorax, and other causes we have is lung disease. Symptoms can be cyanosis, as we know that cyanosis is the bluish in your skin, in your eyes, in your nails. So this is the symptoms, and also like decrease in sound in one side of your chest, etc. Now, I will be sharing you again a screen where there will be images of X-ray for these three type of pneumothorax that we have studied that I have told to you till now. And these images are here, as you can see in this thing. First one is spontaneous pneumothorax. Second one is traumatic pneumothorax. Third one is tension pneumothorax. And I hope that this images gives us information about what is this actually trying to say to us. Now, first one is actually the spontaneous pneumothorax, and spontaneous pneumothorax, as you can see, on the X-ray view appears a very thin, the first one appears very thin, sharp, purer line separating the collapsed lung from the chest wall. So this is the pneumothorax of the spontaneous pneumothorax. And second we have is a traumatic pneumothorax. As I've told, that traumatic pneumothorax is basically because of the trauma. So it shows air in the pleural spaces, as you can see in this diagram, and visible as sharp thin line separating the lung from the chest wall with no long marking beyond this line. So this is about the traumatic pneumothorax. Last but not the least, we have tension pneumothorax, as you can see in the third diagram or third picture. So this shows the mediastinal shift away from the affected side, collapsed lung with a sharp pleural line and potentially a depressed diaphragm. So these are the images of the three pneumothorax that we have discussed till now. And this is the view in the X-ray. If the patient is suffering from this kind of pneumothorax, and if we do the X-ray, these are some of the images that can be seen by the radiologist, or they can diagnose it. So for the diagnostic view, X-ray is one of the most common for pneumothorax because chest x-ray is common. For the patient who can stand, chest x-ray is more common, but we can do other diagnosis also like for CT scan and all. So I would be giving you now, I would be sharing you again, not the article, but a small video about the lab demonstration, like how the chest x-ray is done, so that one can get knowledge about it. And I hope that you will learn more from it. So here is the video.
Hello everyone, welcome to our lab, and today we will be demonstrating about the PA view in X-ray for pneumothorax. As we all know that PA view is one of the most common views, especially for pneumothorax, because pneumothorax is related to the lung disease and it is essential for us to do the scan. For the person who can stand, we can do the PA view, but for the person who cannot stand, there are other scanning view that we can do. For example, lying down in a supine position and doing the scan or view. So today I will be doing PA view, and for that I will be calling my colleague for the patient role.
So as you can see in this, the introduction have been given, and here how the diagnosis is being done is shown. So this is how X-ray is being done here.
So as you can see, here is my patient. Before doing any kind of scan, I will ask him to remove all the ornaments if he have, not by doing by myself, but asking him to do if he has any kind of ornaments to take off. And I will ask him to stand in this position so that we can get a PA view. So for this, I will ask him to put his hand on the hip. With this, the hand on the hip with the palm facing forward, and with the chest in contact with the casket. We have a casket here in which the feet are placed, and which will give us the image. And this one, the neck slightly upward, so that the image that we create will not become, the neck of the image will not come in the feet, and it will be easy for us to diagnose. As we can see that these are already centering of the scan will be at the T7 of the vertebrae.
So this is the thing, and here is the X-ray tube, and it's just a small demonstration. I hope that you understood it. It's a very small demonstration with not more critical things to do, but just to learn that how the X-ray is done for pneumothorax. So this is one of the PA view, like how the X-ray can be done for pneumothorax. There are other views, and another one I will be talking about is about the lateral decubitus view. So what lateral decubitus view actually says is, it is used to identify the pneumothorax by positioning the patient on their side with the respective side facing up, allowing air to rise and be visualized against gravity. So, this is the thing, a lateral side view, in which we can also scan for pneumothorax. So, for clear understanding, I will be sharing you a picture. Here, as you can see, the patient is here, X-ray tube is here, and the ray or exposure comes from here. So the patient is lying on a lateral decubitus view, and the image formed by this is here in the second phase. As you can see, this is the image formed by this kind of a view. So this view is particularly useful for detecting small pneumothorax that may be missed on standard upright chest X-ray, because gravity causes air, which appears black on the X-ray, to collect along the upper side of the lung. So this is another kind of view that we can do for pneumothorax. Now we are coming to our end session. So before it, I would be giving you an example about a patient. So the patient about a case, and this case is about a patient who was 45 years old male presented to the emergency department with sudden onset of the severe shortness of breath and chest pain following a motor vehicle accident. On physical examination, he found to have a lot rapid heart rate, low blood pressure, and decreased breath sound on the right side of his chest. So, this is the condition, or this is the case about a male or about a male patient who is 45 years of old. So, for this case, the image is produced, and the image I will be showing you the image that I have taken from the YouTube for better understanding. So, this is the image typically is. So, I hope that you will understand it. Okay, this is the picture, the last we did, and so here is the video. So this is the image or video as you can see it. So this is with this image only, I've got a case, and this case is related to this image as you can see in it, like collapse lung. Here's the collapse lung. So this is pneumothorax X-ray. So in this picture, what really had happened, I would like to share. For this, the main thing is that this picture is showing us that the patient had get tension pneumothorax. So a tension pneumothorax, as already told, is a life-threatening condition. It's a life-threatening condition. So this kind of pneumothorax leads to a buildup of pressure which pushes the mediastinum, that is the central compartment of the chest containing the heart and the trachea, away from the affected side. So in the provided chest x-ray, okay, I will show you again that from there it could be helpful for us to know. So the video that I've shown is this one, in which you can say that the left lung on the right side of the image appears normal. This one appears normal. This is, since this is a PA view, this one is the left side and this one is the right side. So this appears normal. Whereas on the nor normal, whereas the trachea and heart are shifted to the left, away from the collapsed right lung, which is the classic sign of tension pneumothorax. This is the classic signs of pneumothorax. Means the left side of the lung appears normal, but the right side, this side, appears that it is like some of the uh, lungs has been collapsed in it. So basically this thing is done. So this is what the case study has been said here. So by the end of my presentation, or not a presentation, but by the end of the sorry, by the end of this video, I would be sharing that pneumothorax is a medical emergency requiring prompt recognitions and intervention, which can range from observation from small cases to intermediate to thoracostomy for larger or more severe instances. It is a medical emergency, especially for ventilated patients. So pneumothorax, we should know about it. So the chest X-ray that I've shown, the images. If you want to know about its KVP and MA, the KVP for chest X-ray is it ranges between 100 to 120, whereas MA it ranges between 4 to 8 for the information. And at last, I would like to say that pneumothorax is a life-threatening event that can be quickly treated. It is a life-threatening, but it could easily be treated also. Proper technique will minimize complication. Proper technique will minimize complication. For this, we need radiology department for diagnostic view like X-ray and CT scan. So for management, proper treatment. So it is our duty to not to neglect the symptoms that is happening in our body. We should diagnose it as far as possible. And it is the radiologist and radiographer's duty to not the neglect to neglect the patient's images or the diagnostic views. So management is one of the most important thing that we can do. With this, I would like to conclude my video. Thank you for till now.